Welcome to the Module 4 in Service. This week we will expand upon the topic of professional roles and responsibilities and focus on the interprofessional roles and responsibilities of the healthcare team. Specifically, we will learn about how interprofessional teams work and the concept of professions viewing the same thing but seeing it differently. We will examine role blurring and where the idea of knowledge and respect fits. We will look at the role of the client, patient, family, community on the interprofessional team and take a glance at the shared decision-making process. The definition of team dynamics is the motivating forces that drive a group of people working towards a common goal. It should be noted that these can be positively or negatively motivating forces. Healthcare professions are now teaching interprofessional education in graduate school. So when new healthcare providers join existing interprofessional teams in the workforce, they have an understanding of the theory behind interprofessional practice. Each profession sees a situation from a different perspective. Each profession learns about the impact they can have on patient health outcomes. Seeing a situation from a different perspective is like viewing the same thing as someone else, but from a different lens. As this quote from Petrie says, two opposing disciplinarians can look at the same thing and not see the same thing. Seeing things from another profession's viewpoint enables us to become familiar with and respect other professionals' roles and responsibilities. Barriers to interprofessional practice can occur when there is confusion about education levels of other professions, cultural misunderstanding of healthcare team, perception of professional inequalities, and misconceptions about the role and responsibilities of other members of the team. A key element of professional collaboration and teamwork is knowledge and respect of each professional's role, responsibilities, competencies, and perspectives on healthcare. Without the knowledge of each other's roles, it is difficult for healthcare team members to develop respect, tolerance, and a willingness to work with one another. Role blurring has been found to be a useful strategy in interprofessional practice. Given the extensive roles and responsibilities of healthcare professions, there are numerous ways that role blurring can happen. Role blurring occurs when two or more professions possess areas of overlapping competencies and share responsibilities. Role blurring is necessary for effective teamwork, as workloads can be manageable for all team members and meaningful discussions can occur among team members to devise optimal care strategies for patients. Potential burnout and team collaboration failure can occur if role blurring is not appropriately addressed and handled. Examples of this can be seen where a professional's skills may be underutilized because other members did not realize the contributions the professional could make. In another scenario, the professional may feel disrespected or not trusted. It is also possible that some team members may not capitalize on role blurring, and they may attempt to fulfill all aspects of a conflict in the patient's care, rather than sharing the responsibility with another capable professional. To avoid complications from role blurring, team members should discuss areas of overlapping competencies and renegotiate role assignments where needed. Knowledge and respect of each professional's role, responsibilities, competencies, and perspectives on healthcare is important for successful collaboration and teamwork. Practical strategies to enhance role knowledge are to hold team meetings, create socializing opportunities such as a pizza or potluck lunch, create a photo ID wall with the pictures, names, and role of the team members, or create a master schedule so the team can see who they will be working with on any given day or shift. Opportunities for team members to shadow each other in their day-to-day work can create role clarity and the added benefit of team bonding. Some healthcare teams have created a newsletter or web page to enhance role understanding by highlighting the roles and responsibilities of one particular professional in each issue. Power is the possession of control over others, and in this case is usually by presumed authority or traditional hierarchy. Attitude is related to manner, disposition, and emotion, specifically towards a person or a thing. Through the direct transfer of profession-specific attitudes, knowledge, and behaviours, a professional culture is developed. As a result of this socialization, learners pass through pre-licensure programs with stereotypes of their professional identities and those of other professions. Professionals bring their profession's cultures and hierarchy into the healthcare environment. They have a series of attitudes, beliefs, and understandings of what a profession means to them and how they see themselves in a professional role in the future. These stereotypes can present challenges when the learners are working together in an interprofessional team-based environment. Power differences among professionals constitute an important barrier to interprofessional collaboration. Equality is a basic component of building teams that work together more effectively. Interprofessional accountability is based upon accepting and sharing responsibilities and participating in team decision-making and planning. One of the primary aims of collaborative healthcare is to distribute responsibilities so that no member of the team becomes overwhelmed with work. Team members must recognize when to accept and share responsibilities. Determining where one's responsibilities begin and end in a collaborative team is not always easy and is where role blurring comes into play. The patient has a central role on the interprofessional team. We know that the patient often sees health from a different perspective to care providers. Patients provide the healthcare team with their perspective of their experience of illness, information of their social circumstances, their attitude to risk, their own values, and their care and lifestyle preferences. The role of the healthcare team is to provide the patient with their expertise and knowledge of the services and resources available. The healthcare team's expertise in diagnosis, disease etiology, prognosis, treatment and therapy options, and outcome probabilities are used to guide patients in their decision-making process. Shared decision-making occurs when patients and healthcare providers make decisions that are informed by the best available evidence about potential benefits and potential harms. Patient preferences are a central component. Professionals contribute their assessments, knowledge, and judgment to the team. All involved team members reflect on the situation and discuss the best outcomes relative to the evidence. The team will come to a shared decision based upon the patient's goals and create a joint plan of care to implement the treatment or therapies necessary. As was stated before, patient involvement is essential for success. Understanding the relationships between interprofessional team members and how their roles and responsibilities overlap is important in referring patients to the other professional services. Knowing when to refer your patient, knowing who to refer your patient to, and knowing how to refer your patient and therefore optimizing patient health outcomes is key to interprofessional practice. Thank you for attending this in-service. I hope you have a greater insight into the concepts surrounding interprofessional roles and responsibilities. As you get to know the roles and responsibilities of the numerous healthcare professions in Canada, you will discover lots of interesting similarities, differences, and overlaps to your own profession. You may find that the professions researched in your own team add a different perspective to the way you answer the Module 4 case scenario questions and others going forward. You will be able to apply what you've learned in this in-service to the Test Your Knowledge quizzes and activities. See you at the next in-service and have a great nursing shift.